Lieutenant Governor Kim Driscoll is our guest this morning. Let's go on the record. Walking stride for stride with the governor on issues from child care to housing to the migrant crisis. How she's putting her stamp on this administration. The LG's in the chair. Let's go on the record.
From WCVB Channel 5, the inside word from Washington to Beacon Hill. Today's newsmakers are going on the record.
Welcome to OTR, everyone. I'm Ed Harding, along with News Center 5's political reporter Sharman Sacchetti. It's great to have you with us. And as you can see, Lieutenant Governor Kim Driscoll is with us at the table this morning. She took office as the state's LG in January of 2023, a year ago. Before that, she served as mayor of Salem for 17 years. Born in Hawaii, your dad, a Navy veteran. She holds degrees from Salem State University and the Massachusetts School of Law. It's always great to have you in the chair. Great to see you.
Glad to be here.
You know, and it's probably too late to say Happy New Year, but Happy New Year, because this is the first time I've seen you.
You can say it all the first quarter. You're good to say it, right?
Great to see you. Thanks for coming in.
All right, let's start with the migrant crisis. You were with Governor Healy earlier this week, or last week, when as a rec center in Roxbury became the state's latest emergency shelter. Here's what the governor had to say about it.
We're here today because we really don't have a choice.
Now, she says there's no choice. The situation has not shown any signs of stopping. Is there going to be a point where the state just can't do any more?
I mean, I think it's one of the reasons we put a cap in place. We have 7,500 families who are in emergency shelter. This is an overflow site. We are continuing to see families coming here still. We only, are really serving families. And for us, it's really just, we do have a law that requires right to shelter, but I think it's consistent with our humanitarian values.
What happens in May when this shelter closes May 31st?
Yeah, we're already looking and working closely with communities, small and large, to partner on how we can better stand up a facility that can serve us after this CAS site comes offline, which we're committed to at the end of May, if not sooner. And with the goal of trying to get folks in shelter and out of shelter. We've got 3,000 of our new arrivals who have work authorizations. They are eager to work. We have workforce needs that we know are unmet, so we're trying to do that matchmaking. Our goal here is for folks who are here to get them out of shelter as fast as we can.
Well, Congressman Richard Neal sat in that very chair last week, and he agreed with the governor that this is a federal problem. It's an election year. Congress is bitterly divided. The administration keeps asking for more money from Washington. But at least from the eyes that you can see outside, nothing is happening. So where do you go with this?
Yeah, super frustrating. It is clearly a federal problem. We don't work on border security at a state level, but folks are coming here. They do have lawful entry. We continue to press Congress. President Biden has put forward, we think, a very good plan that would increase border security and provide aid to communities across the nation that are seeing this influx and trying to do their best to try and keep up with the needs of folks who are coming here who are seeking a better life. Young families in tow, pregnant women. I don't think we can turn our back on that population. We have a large Haitian diaspora here. That's one of the reasons I think folks are coming here. But we need help, and we've said that from the get-go, and we're hoping that Congress will, get this bill passed.
Well,
there are real people impacted.
It doesn't look like that's going to happen. Republicans have said they want to run on this issue. The former president wants to run on this issue. So it doesn't look like it's going to happen. So right now, it seems like states and cities and towns, they're on their own. So what other locations are you actually considering to be potential shelters, since this doesn't really show any signs of stopping?
Yeah, I mean, we're already in 90 communities across Massachusetts, communities small and large, who have really stepped up to say, what can we do to help? We're consolidating those locations to try and, reduce the number of sites that we're operating on. And definitely, we have an overflow site in Cambridge. We have one in Boston. We'll continue to partner with communities to try and identify the best location to serve this overflow need.
Would expediting the work permit process ease the pressure? If people get into the system and then builds up the pressure.
100%.
100%.
100%. Folks come here, they want to work. This population is eager to work. Every shelter we're at, folks want a job. They want to get out of shelter as fast as they can. We've got 3,000 folks who are already matching up. My own community, Salem, where we have a shelter. Salem Hospital now has a fully staffed housekeeping department, the first time in years as a result of some of our new arrivals getting their work authorizations and then getting a job.
How quickly can they get out of the emergency?
Yeah.
I mean, the average stay is about a year.
It is, but some of that is our own Massachusetts families. Our longest stayers are frankly Massachusetts families. So it is coming at a time when we have a housing crisis. One of the things we're also working on. But by getting folks a job, teaming up with other families, the way waves of immigrants have come here before, we're really hopeful we can get folks on this pathway to out of shelter and into a more sustainable environment.
Item 2 was the situation with Steward Health Care and the fate of several local hospitals. Steward now says it has secured financing to keep them all open for now, but the chain's financial status is very shaky. The fate of several medical centers is in doubt. Where do things stand with the crisis? Let's start there.
Yeah, I mean, I think it's pretty clear these private equity firms owning hospitals can be really challenging. We have a all of government approach to trying to put in place some interventions, understand what actions we can take, most assuredly to safeguard patients and patient care, to make sure our workforce are preserved, and then keeping communities in mind. If you're a community that hosts one of these hospitals, it's a major institution in your community. It's often the largest employer, the place where people go for care. So we know it's important for us to be working across all levels with a very precarious situation. This is complex, lots of competing interest when it comes to the dollars that are already involved from the private sector. But we couldn't have a better person than our Health and Human Services Secretary, Kate Walsh, who ran BMC. She comes from that world, armed with other officials who are really working hard to try and understand how can we intervene and keep communities safe.
What is the state doing about it?
Yeah, so there is a cross-purpose, a team of not only state employees, other agencies involved, trying to assess what the circumstances are. We have DPH has teams on the ground in all of these places, making sure we're seeing the type of safe care that we know is important. We're talking about the workforce needs and certainly want to keep community leaders informed about what sort of steps and actions are happening. There's a little bit of reprieve with this most recent announcement for funding, but this is a problem that we're going to have to be involved in, I think, for several more weeks and months.
Item 3, Walgreens. Despite community pushback, Walgreens shut down a pharmacy in Roxbury last week, so that leaves the neighborhood without a pharmacy. Is the administration engaged with the pharmacy chains at all on this? I mean, a neighborhood without a pharmacy is not a good formula.
Yeah, it's awful when you think about all the things we rely on for places like pharmacies, whether it's a Walgreens or a CVS or any of those places. And I think we're really trying to lean in to make sure, first and foremost, folks who need their prescriptions are filled, like they have a place to go for that. A lot of our community health centers have integrated pharmacies. We want to better connect people with care. And I think it's a longer term issue beyond just the pharmacies themselves. How do we ensure better access to health care? Massachusetts, world-class healthcare institutions. How do we make sure we close these health equity gaps? And that's a big part of the agenda.
Does the state have any leverage, for example, to keep a pharmacy in that neighborhood in Roxbury?
Unfortunately, not a lot. And these are private sector partners, private leases, between entities. And so there's not a lot we can do to stop it from happening. But what can we do to make sure there's not a gap that's left when it comes particularly for medicines and access to really important, medical needs that people have at that ground level?
All right, let's talk about teacher strikes in Massachusetts. We've certainly seen our fair share, haven't we? And yet, as we've seen in Newton and elsewhere, they continue to happen even though they are illegal. As a former mayor, you know a lot about negotiating contracts. You were a mayor for many, many years. What is your take on this?
I mean, I think first and foremost, we want to do everything we can to make sure communities have the resources they need to pay educators. It's such important work. We all know that. We also know that strikes are illegal. And so we, really value working that hard work you have to do at the bargaining table to try and get an agreement, to try and prevent a strike, and doing everything we can to make sure, most importantly, kids are in classrooms.
These are happening. These teacher strikes are happening in part because they're working.
Well, I think that it really does beg a question to us. How do we work collaboratively with our community leaders, with our union officials to try and understand what can we do to prevent that from happening? It is against the law. That's first and foremost. We are providing more resources as a state to communities for education through Chapter 70 and other dollars than we ever have. And yet this is still continuing to happen. So we've got to put ourselves in a position to try and do all that we can to prevent strikes from happening and keep kids in classrooms. We have chronic absenteeism happening in many of our schools. We know that the best place for kids are in schools, and we want to do everything we can to make sure that happens.
And obviously, we've mentioned that teacher strikes are illegal, but should teachers have the right to strike?
Well, we don't support a change in that law, I can tell you that.
Yeah.
Just like police and fire can't strike. The best place, for kids is in the classroom. We believe that. And when teachers are not there, that means kids aren't there. And we're certainly seeing that play out in Newton with parents and families who are really struggling, especially our special needs students, who for them, it's a real setback when you're not in school.
Which brings us to childcare. It's become a key priority for the administration.
Yeah.
Last month, the plan was unveiled to make childcare more affordable and accessible, expanding universal pre-K, part of the effort to make Massachusetts more affordable, but also, amen, and I'm not splitting the atom here, it's an expensive budget item. It looks like election year politics could kill a federal effort to increase the child tax credit. Can money be found for the Commonwealth to press ahead?
Yeah, we believe so. We have a budget that we think is fair and equitable and balanced. We know what education means, particularly early education. The research is clear. That's great for our youngest learners. We also know it helps parents, particularly working parents. So we're helping 2 generations by these sorts of investments. If we could pair that with some of the work that's happening at the federal government, an additional child care tax credit there, combined with our most generous in the nation child independent tax credit, this is going to really tackle the affordability agenda that we think is really important for Massachusetts.
You think the state can afford this?
Oh, absolutely. I think we can't afford not to. Now, that doesn't mean that the state is the only player in this. It's pretty clear as part of our efforts to increase our investments in childcare, we also need to work with our private sector partners. We've got a commission working on ways we can work together to ensure that the workforce needs are met and that our youngest learners are getting the best high-quality experience they can. Ideally, we'd want all 4-year-olds in a high-quality, pre-K experience, and we're working through that right now, leaning in on our gateway cities to start.